you doing? My name is Jason from BodyMend Wellness Clinic. Just talking about some different postural things that come into the clinic which basically lead to pain in our body. A lot of these things can be easily caught or alleviated by doing simple exercises or stretches. Unfortunately, most of the problems that we have that would come into the clinic or that a lot of clients complain of is always low back, neck problems, and predominantly these are caused by postural problems. And the biggest problem is that we spend probably 80-90% of the time in a chair. One of the biggest problems that we have is our low back problems. So predominantly a lot of times low back problems, and a lot of people don't understand how this typically works, but most of the time it's a hamstring problem. This would be the muscle in the back of the leg. These are your quadriceps, these are your hamstrings. When hamstrings are tight, they basically attach to the bottom of your bum, and when they're tight, they posteriorly or they pull down on the pelvis, which then pulls on your low back and the vertebrae. When we are seated, hamstrings are in a short position, meaning that they are in the shortest position possible. When we do this for extended periods of time, the body associates this as being normal. When you go to stand, now you're lengthening the hamstring. The body says, well, this is not normal, we're going to go back to sitting. So we're not going to adjust the length or the tonicity of the muscle, basically how hard it is or how tight it is. The body's typically always adjusting the muscles and basically how toned they are. Otherwise our muscles just be all kind of jiggly. But the body still recognizes that certain postures are done more often than other postures. So this being tight, your hamstrings being tight all the time, when you're seated in a chair, you do this for extended periods of time, this will pull on your low back. So the easiest thing we can do is stretch our hamstrings. A lot of times we don't have time to sit on the floor, we don't have times to put our foot up on a chair or anything. So the easiest stretch, and we've also addressed this in other blogs and other types of media that we've on our website, but it's always good to revisit, is basically you're in a seated position, so you're at work. Basically what we're going to be doing is sit on the edge of a chair, okay? Preferably a little bit harder chair. Leg out, okay, other leg bent, your toe straight up. Keep your back straight. You're bending here, not in your low back. And you're going to come forward, keeping your back straight. Beautiful part, you can still type, you can still work on your mouse, you can talk on the phone while doing a stretch. You can even have a meeting while doing this and no one knows that you're actually stretching. What this will happen, it will alleviate low back pain. The biggest thing, and a lot of people don't understand how this works because it comes a lot of anatomy that you have to learn and also just the mechanics of how the body works. But essentially if someone were to come into the clinic, if it was yourself or anybody else, and they cannot move because their low back is hurting them so bad, being a massage therapist, I do not touch the low back. I only work on the glutes and the hamstrings, and the client will walk out of here with a lot less pain. There'll still be the injury and that still needs to be recovered, but they'll be able to walk better and they'll be able to function a little bit better throughout the day. So this always goes to show how a lot of times the area that we're treating is not necessarily the problem area. That's more the symptom. So thank you.